This is apropos. The United Nations says it will have no involvement with controversial US-Israeli plans to provide aid to starving Palestinians as Israel's months-long blockade brings severe shortages to the war-battered territory. A Washington-backed humanitarian organisation says it will be starting work in the besieged enclave by the end of this month under a heavily criticised plan that will see private firms instead of aid groups transporting supplies into Gaza to a limited number of so-called secure distribution sites in the south. France 24's Jessica Le Masurier is at UN headquarters in New York.
The Gaza Humanitarian Aid Plan appears to be an effort to take over from the United Nations and privatise the delivery of aid to Gaza. There's been an Israeli blockade on aid since March 2nd, and it's left civilians there starving. Both UNICEF and the World Food Programme say that famine is looming in Gaza. Well, the new proposal appears to be an Israeli idea that is fronted by a US-backed charity. The charity will enlist the help of private security contractors to execute aid delivery in Gaza. Israel said that this plan will be enacted by the end of the month. But this is all extremely controversial. Why? Well, because it will use two private security firms based here in the United States. One is called Safe Reach Solutions, and it's led by the former head of the CIA's paramilitary arm, who also has links to the company that ran notorious private security firm Blackwater. And the other is called UG Solutions, and it's run by a former US Special Forces soldier. The plan also involves emptying the north of Gaza. The aid hubs will be in the south and forcing Gazans not to go back to where they came from in exchange for receiving aid. Well, the UN has rejected this plan, saying that it weaponises aid and threatens to cause the mass displacement of Palestinians. The EU's former chief diplomat, Josep Borrell, has gone a step further. He has accused Israel of ethnic cleansing and of using the starvation of Gaza's civilian population as a weapon of war. Well, the call from the United Nations is just let us do our work, just let us deliver aid to civilians in need in Gaza. It's important to point out that the UN can deliver aid effectively, as it did during the recent ceasefire and according to humanitarian law, if Israel would only allow it to. Well, Israel's envoy to the UN, Danny Danon, has said that the idea of this new aid model is that Hamas will not be able to take advantage of humanitarian aid. So that's Israel's argument. But the problem with this Gaza Humanitarian Aid Foundation plan for many at the United Nations is that they see it as a trap. Whilst it might be called humanitarian, they believe that its actual objective is not humanitarian at all. It's political and military. Well, British Ambassador to the UN, Barbara Woodward, had a clear message for Israel from EU members of the Security Council earlier on this week. She said, lift the blockade on aid and enable the United Nations and humanitarians to save lives. She said that any model for distributing aid must be independent, impartial and neutral, and in line, of course, with humanitarian law. She said, well, we can't support any model that places political or military objectives above the needs of civilians. However, it's unclear what the EU or the UN can do to stop this new plan from being pushed forward by Israel and the United States.
France 24's Jessica Le Masurier. Well, for more, we're joined now by Alexandra Saieh, Head of Humanitarian Policy and Advocacy at Save the Children International. Alexandra, thanks so much for being with us this evening. As we've been reporting, aid hasn't been allowed into Gaza for over 2 months now. We've heard repeated warnings about the risk of famine. You have teams on the ground in Gaza. Talk to us about the ever-worsening humanitarian situation there.
Thank you so much for having me. Gaza today is the worst that it's ever been. It's the worst that we've seen since the start of the war. And the stories that we're hearing from our teams, from parents whose children we've supported, from other colleagues are absolutely harrowing. Not a single person in Gaza today has enough to eat, including our staff members. Every single child in Gaza is at risk of famine, and families are taking absolutely unimaginable measures just to keep their children alive. We've heard harrowing reports over the last few days from former colleagues, from parents whose children that we've supported over the last few months of needing to feed their children animal feed, expired flour, flour ground up in sand, leaves, grass, anything that they could find just to keep their children alive. We recently spoke to a father in northern Gaza whose wife is pregnant and he has a 2-year-old child, and he told us that they have absolutely no other choice. His child is constantly sick, constantly weak, has diarrhea. His child is suffering from hunger pain constantly. He's worried that his wife, who's pregnant, is going to lose the baby. And these are typical circumstances for people in Gaza. We hear these stories all the time. So it's absolute desperation in Gaza. And aid workers themselves are just as affected as everyone else. Colleagues are telling us that they're so exhausted that they're unable to work. They spend their days looking for food, hours walking around, finding absolutely nothing in the market to buy. And what remains, the little that remains, the prices have skyrocketed so high that it's absolutely unaffordable to anyone. We are seeing hospitals completely depleted of medicine. And when there are mass casualty attacks in Gaza, doctors can't even find people to donate blood because people are too malnourished to donate blood. That's how bad it is right now in Gaza. And for newborn babies who have been born into this war, they're facing the risk of death because the hospital system has been absolutely obliterated. So the situation in Gaza is more desperate, more harrowing than we've ever seen it.
And Alexandra, as you've been reporting, the UN is saying that it is not under any circumstances going to be involved with this new US-backed foundation that will be delivering aid to Gaza by the end of the month. Explain to us why humanitarian groups are so opposed to this plan.
Well, this plan, as we have heard, involves armed actors. It reduces the number of hubs where aid groups are able to provide assistance to just a few. It essentially excludes the most vulnerable people in Gaza from assistance. How are the elderly who have been starved, who are too weak to walk, supposed to walk several miles just to get aid? We've also seen over the last several months the dangers when military or an armed actor is involved with aid delivery. We've seen multiple times over the last year people being killed while waiting for food, while waiting for flour. So how is this supposed to work? This plan risks making the situation even more dangerous, even worse, exacerbating needs, intensifying suffering for families who have already been starved and who are traumatized and who have suffered so much.
And Alexandra, Israel time and time again justifies the aid blockade on Gaza by saying that Hamas is stealing the supplies that have been sent into Gaza. What do your staff on the ground make of claims like that?
These claims have never been verified, and we have humanitarian personnel on the ground who are trained, who have the expertise, who have the know-how to deliver assistance when it's possible and when we're allowed to. Organizations are just asking to be allowed to do our jobs, but we have not had the safety, we have not had sufficient supplies, we have not been given the access to be able to do that. Every organization in Gaza has trucks filled with aid waiting at the border just a few miles away from where people are starving. And the lack of safety as well cannot be underestimated. When we had the ceasefire in place, Save the Children, in the month of January alone, was able to reach more than 10,000. We were able to screen more than 10,000 children for malnutrition in one of our clinics in Deir Bella. In the month of April, so this is after the collapse of the ceasefire and after the reimposition of the siege, we were only able to screen 500 children for malnutrition, and a quarter of those children were found to have acute malnutrition, which is something that requires immediate intervention in order to ensure that the child survives. So what we're seeing is that since the Israeli siege was reimposed on March 2nd, and since the collapse of the ceasefire, it has been absolutely impossible to deliver assistance at scale. And we know that there are malnourished children across Gaza that are not receiving the aid that they need to survive because of the conditions, because of the lack of safety and the lack of supplies. We don't have any food stocks left. We have about 6 weeks of medical supplies. Most organizations in Gaza have either run out of supplies or are about to run out of supplies. So, and WFP has said that they've run out of food. Community kitchens are closing. So the situation is absolutely catastrophic, and we are about to see a surge in deaths due to the spread of disease and malnutrition if something doesn't change immediately.
If something doesn't change immediately, that's the key issue here. We've been hearing these warnings for months now from the UN and aid agencies like yourselves. Why is the international community failing to act?
No, it's a good question. The failure of the international community to act, but also those that are fueling this crisis are at fault here. Humanitarian organizations have been pleading to be allowed to do our jobs. We are trying, but without the political will to ensure that the Israeli government lifts the blockade and allows aid in, there's not much left that we can do. And this is on the international community to ensure that Israel meets its obligations as the occupying power. They have an obligation to facilitate humanitarian assistance. And what we've seen is that not only have they failed to do that, but the international community has failed to push the Israeli government to do that. We have staff on the ground. We're ready to support. We have the training. We do this in conflict zones all over the world, but it requires political will.
And that political will, speaking of, Donald Trump is in the Middle East at the moment. Of course, he's not been visiting Israel. Who now has the leverage to put pressure on the Israeli government if it's not going to be Donald Trump and the US?
Every single country, every member state has an obligation to ensure and prevent atrocities from taking place and ensure that governments abide and fulfill their obligations under international humanitarian law. So it's on every single state to ensure that they're using their diplomatic leverage to get aid into Gaza. We need safety, we need supplies, and we need to be able to do our work independent of political motivations or military objectives. We need to be allowed to reach the people most in need. We do this in other parts of the world, and we can do this in Gaza if we are given the space, the access, and the safety to do so.
And Alexandra, some might say that, you know, even though the UN and aid groups are not supporting this US-backed plan that will see some aid being delivered into Gaza from the end of the month, perhaps it's better to see some humanitarian supplies going into the territory compared to what we're seeing at the moment, which is nothing being allowed in.
To be able to deliver humanitarian assistance effectively, we need safety, we need supplies, and we need to be able to reach people most in need. And we need to be able to do it independent of political objectives. With this plan, none of that is in place, and it risks creating an even worse situation with armed actors being involved. It could intensify suffering. You know, the answer is easy. We just need the Israeli government to lift the blockade and allow us to do our jobs. We have the teams there, and we're ready to go as soon as we're given that space.
Alexandra, thanks so much for being with us on the programme this evening. We do appreciate your time and your analysis. That is Alexandra Saieh, Head of Humanitarian Policy and Advocacy at Save the Children International.